My name is Amy Avalon. I'm a retired psychotherapist, and I was in private practice for many, many years. And I'm also here because I found out that a colleague of mine, someone who I really respected and had worked with for many years, was a sexual predator and had been abusing not only one client, but I would later find out that he had abused several clients. So, as you all know, in the mental health profession, as in all health service professions, using a patient or a client for one's own sexual gratification is the ultimate betrayal of trust and abuse of power. And we're taught from our very first ethics courses that it's never, ever acceptable to have any sexual contact with a patient. We know this. And often feelings of a sexual or erotic nature can come up in therapy, both for patients and for therapists. But therapists are trained to be vigilant of these boundary issues and any transference or countertransference that may arise. And we know that we're supposed to address this in professional supervision in order to avoid harming our patients or clients and to uphold our ethics standards and protocols. These aren't things that we process with clients. You don't bring this up. You don't bring your countertransference up with your clients, as you know. And that's the major distinction between what is normal and what's pathological and abusive, is how the therapist responds to these kinds of feelings that they may be having. An abusive therapist will bring them up with a client and begin to normalize them with a client in an effort to transgress boundaries. An ethical therapist will realize that this is something that they need to work with in supervision, and it's not a part of the client's therapy. And remember that whenever any type of exploitation, boundary violations happen in therapy, there just are too many choice points. There's too many opportunities for a good ethical therapist to stop themselves and to consult with other professionals prior to carrying out any transgressions. A lot needs to happen prior to these kinds of, major offenses, major misconduct. It generally involves many small boundary violations over time that disarm, arouse, and confuse the client. And even to the point that these blurred boundaries, it's almost like the client doesn't realize what's happening because it's so subtle on the part of the abuser. And they feel like they're even consenting to, allowing, and maybe even initiating these boundary violations, which is never true. And this is the process called grooming. It's at the heart of why this behavior is so sinister, because the abusive therapist grooms the client so subtly with these, little transgressions that the client really doesn't even know what's happening. And all of these types of transgressions and the misconduct that results, it's always the result of premeditated, calculated, and repeated violations on the part of the abusive therapist every single time. Like I said, it's never spontaneous. It's never an accident. It's never a mistake. And it's someone who obviously believes that the standards don't apply to them and that they aren't going to suffer any negative consequences if they move outside of those standards. Sometimes you might hear experts even, but other colleagues of yours, they might say, oh, these violations can happen to anyone, someone who's maybe vulnerable, a therapist who's very stressed. That's not really true. The truth more often than not is that there's an underlying narcissistic pathology and entitlement in the therapist, even a psychopathy. And that involves using patients for their own gratification, placing their own desires above the patient's needs and goals. This really is never, ever a mistake. It's never an honest mistake. And if it were, you would have a very different response from an ethical therapist. They would want to make amends, they would follow established protocols, and they would remove themselves from the opportunity to cause any further harm. The unethical abusive therapist's response would be to deny that there's any harm going on, to minimize their own behavior and choices, and to blame either their client, anyone who's challenging them on their behavior, but they will avoid all responsibility. So those are kind of hallmarks of the difference between someone who is an ethical therapist who might have made an honest mistake in therapy versus an unethical therapist or an abusive therapist. So let's talk a little bit about who the victim is and who the perpetrator is, because in our field, like in all fields where transgressions, violations of power happen, abuse of power happens, people have an idea of who those types of people are, the types of people who abuse the power, and the types of victims that they target. And when I was in school and practicing, I'm sure that I was biased that way too. I imagined that I would be able to spot both a victim and a perpetrator a mile away. I imagined perpetrators to be overt narcissists, very grandiose, very entitled, people that I would just immediately feel negatively toward. And I imagined that their victims were people who probably had a significant trauma history, people who were really struggling, people who were incredibly vulnerable, maybe people who didn't have as many resources, maybe people who had been violated before. So I had all of these biases, and I think that a lot of my education fed into those biases. I think my colleagues and mentors also believe the same thing. But the research shows a very different picture of both the perpetrator and the victims. Sandra L. Brown, who is a therapist who's been studying psychopaths and their victims for decades, found she had these biases too, but she found over time that actually the victims were mostly very professional. Not a lot of them had a significant history of trauma. And even if they did, they had already made so many strides to overcome it. In their public or professional lives, they were very accomplished. Most had a bachelor's degree or higher. And they, a lot of them didn't have a lot of relationship issues as a history, but they did have certain traits that made them attractive to the perpetrator. And these traits are a higher degree, elevated levels of empathy, elevated levels of loyalty and trust, a higher ability to see things from many different sides, and an appreciation that people can have different perspectives of the same event. Also, they have elevated levels of taking responsibility for their own choices, almost to the point where they might take responsibility for things that actually are not their own. This is particularly a trait that these types of abusers will exploit, and this is how they shift blame onto their victims. They also are incredibly amicable, and they're usually have a higher tolerance for discomfort because of their ability to empathize, and their loyalty. They will stick it out a lot longer than maybe people who wouldn't. Now, at the same time, there isn't just one type of victim, but predators do tend to look for the very traits that they themselves lack. So when someone has these traits in abundance, it's like they're going to a feast, and they just want to fill themselves up on all of the things that they lack. And they use these very traits, which have made the victims so successful in other parts of their lives, that they make them really particularly vulnerable to the predator therapist. The predators also are very different in their profile than what I would have assumed and what most of my colleagues would have assumed. These predators often cultivate a spotless reputation. They're beloved in their communities. People think very highly of them. They work very hard on their image. And they're also often awkward. They sort of play the meek, mild, and misunderstood type of person. While they might be very accomplished, some of them might even be on radio shows, they might be best-selling authors, experts in their field. In relationship to their victims, they often will take on they often feign humility and vulnerability. And so they like to make their victims think that it's an equal playing field, that that this particular dyad, where they're doing the exploitation, they like to reveal things about themselves that make the victim believe that it's no longer that power differential between therapist and client, that this is a relationship of equals. And that's why the standard of not going into a relationship of any kind that's outside the accepted boundaries of the profession, that this is somehow an exception. That's how they make their clients believe this. As colleagues, it's important to be aware of red flags that lead to these kinds of boundary violations, this kind of egregious misconduct. So as I look back on what happened to me, I remember that this colleague, on many occasions, we argued about boundaries, and he used to talk about when I would take issue with his boundary violations, he felt that it was really petty because they were very small. Whether it was that he wasn't enforcing cancellation policies, he was running sessions too long, he was having dual relationships or taking gifts from clients. For example, maybe he would have a client who was a painter, and he would purchase one of the client's paintings. That's a violation. And he would say, that I was just too strict. But over time, now as I look back, it's just a pattern of boundary violations that most ethical therapists who are following the standards just simply don't do. And an ethical therapist would also take that feedback, look at their standards of the protocol, their ethics codes, and then realize, oh yeah, I guess I did get a little lax there, and they would rein themselves in. That's what good professionals do. Abusive professionals, again, deny, minimize, and blame. You can always look for that cycle with abusers of any kind. They will always deny the transgression. They will, if they can't deny it, they will minimize it, calling it, they will rationalize it away in some way, saying it's not harmful. And they'll blame you for bringing it up, saying it's your problem, or they'll blame the victim. They'll blame the ethics department. They'll blame, the legislators, anything but taking full responsibility for their own behavior. So those are your red flags. You'll see someone because anybody who's going to violate small boundaries, you can bet that they'll just keep pushing the boundaries and violate bigger and bigger ones. When they have no respect for things on a small level, they tend to not have respect for any of the codes. For example, when I would confront my colleague about my concerns about his boundary violations, he would say I was too rigid, too clinical, too sensitive. And even when I was outraged at the discovery of his sexual, ethical, and fiduciary breaches, he said I was overreacting and that I wasn't open-minded enough about love. I would later find out, having worked with so many victims now, since it's happened, that everything that my colleague did was textbook. It is across the board. It's the phrases he used, the rationalizations he used, they were nothing unique, nothing new. You will see this across all abusers and all of these situations. So just remember that when we discover that someone close to us or someone that we respected, whether we know them personally or just from afar, someone that we really care about or feel reverence for in any way, whether it's a mentor or someone who's very famous in the public eye, when they've done something really horrible like this, something that you think is just a no-brainer, like who would ever harm a client in this way? We experience a roller coaster of feelings, and it often follows that Kubler-Ross stages of grief, where you're in denial about it, then you're angry, and you're bargaining. You're hoping that there's just some major puzzle piece you didn't understand, and there's a lot of depression. And then you eventually have to accept the truth about this person, that who they claim to be is very different from who the truth of it's very different from the truth of who they actually are, which is a predatory, abusive therapist. I can't emphasize this enough. It's never, ever a part of treatment for any therapist to engage in any sexual acts with a patient, and any harm of any sort, any violations of boundaries. There's never a reason to violate boundaries in order to help a client. The boundaries are there for a reason. And remember, working with clients in this way as a therapist is a privilege. It's not a right. And so if we are to enjoy that privilege of helping people, then we have to follow the established rules and protocols. And if we don't, we have to expect that we will suffer the consequences, and so will our clients. So therapists have a fiduciary duty to help support the patient's healing. And when a therapist becomes a perpetrator, all gains that the patient may have achieved up to that point are reversed. There's nothing good that comes from any boundary violations. The reason I'm emphasizing this is because you will often hear from abusers, or even from victims who aren't fully aware of what has happened to them yet. Abusers will often justify and rationalize their choices as, I was operating outside of the boundaries because this is what was better for my client, and the client agreed to it. And the client might say, yes, I needed a different form because of what had happened to me, because of my history, because of my personality type, because of my experiences. I needed a different approach, and I was happy to participate in that. It's just never true. People seek out a therapist for help, often when they're at their most vulnerable. And it's our responsibility, and we're bound by these professional standards that have been there since the beginning of the profession, since Hippocrates. We're bound by those standards, by our duties and laws, to keep ourselves in check so that we don't use our patients to fulfill our own unmet needs. Unfortunately, some of these abusers can have long careers of abusing patients because they go to great lengths to hide their behavior, rationalize behavior, and sadly, because colleagues who become aware of the abuse don't hold their peers accountable, whether it's due to avoidance, denial, enabling, or collusion. This is true in our profession. I didn't want to believe it, but the collusion in the profession is profound, just like in every other profession that has been exposed, just like in the clergy or in Hollywood or in politics or in academia. We see this all the time. Our profession is we're not excluded from this. The predators are alive and well in therapy just as much as they are in any other profession. And I know that speaking up and reporting a fellow professional can feel frightening, can feel confusing, and extremely uncomfortable. But ultimately, it's the right action to take because it protects the field and all the clients and all the people who are behaving ethically. It doesn't help anybody to continue to allow these people to hide in the shadows and to give them chance after chance. These people really can't be rehabilitated. And like I said, working with clients in this way is a privilege. It's not a right. And if they've shown once that they're not able to follow the boundaries, they need to find another job. There's plenty of other things to do besides being a therapist. So if we discover that another professional is abusing a patient, again, I believe it's our duty to report this behavior to the applicable licensing board or authority, not to just keep silent about it. It's not your responsibility to decide whether or not this colleague is fit to continue to practice, whether he deserves a chance to resolve the situation without exposure. And if the abuser wants to remain licensed, he needs to follow the guidelines that govern the license. There's protocols, whether he turns himself in or she turns herself in or she reports herself or she just leaves and refers the client out. It's really just your responsibility to go to people who do have experience in handling this. That's usually a licensing board, sometimes the police, your own malpractice attorney can advise you. You could reach out to organizations like therapyabuse.org and get great advice too. Go to your mentors and supervisors. Again, this is not your job to fix the situation, nor to take care of that person's client. This is not your client. You are acting in your professional role, yes, but remember your rights as a citizen come first. And so you need to, just protect yourself and realize the extent of your ability to intervene and where those limits are. You're not an expert in this. So, and remember that these situations do not just affect the dyad of the abuser and the victim. And it's very easy for people who are in denial or who are afraid of the abusive therapist's power or retaliation. It's very easily to just walk away and say, you know what, it's between those two. It's not affecting me. It's none of my business. But it does. It affects the victim hugely. It affects their family, all of their relationships. It affects all of the clients of that abusive therapist, even if they're not in an abusive relationship yet with that therapist. It affects the field. It affects our own legitimacy. This has far-reaching consequences. It's not just the victim and the therapist who are experiencing the problems that are associated with this kind of abuse.